Good morning. COVID-19 has been with us for nearly 2 years. I stood in here in this building on March 7th, 2020 to announce the first confirmed case in Missouri was in St. Louis County. We had no way of knowing how long it would last, how many people would become sick, or how many people would die. The idea of a vaccine becoming available within a year seemed out of reach, and variants continue to challenge responses to the virus, especially with no uniform efforts to mitigate the virus statewide. We took actions that we knew would slow the spread and save lives. It should have been a time of unity, but it was used as an opportunity to divide us. As a result, more people became sick and more people died. We did not make decisions in a vacuum. We heard what was happening in the hospitals and in our medical centers as they joined forces to form a task force to provide regular updates to the public. We listened to public health experts who studied viruses and how they spread. We listened to the public scared of a new virus that was spreading across the globe and taking the lives of our loved ones. As an elected official, I could have taken the easy road and done nothing. But as a doctor, there's no way I could do that. I've taken grief from COVID deniers and listened to anti-vaxxers spread their dangerous lies and misinformation. Criticism always comes with the job. But I'll always defend our response and push back against those who think politicizing a pandemic is their path to higher office. In early January, we were seeing record COVID cases, and our hospitals were struggling with numbers of sick people admitted each day. Omicron was spreading at such a rapid rate, the numbers were literally off the chart, initially designed to measure COVID activity. But with the mask mandate, a continued effort to get more people vaccinated, and the virus weakening, we're in a much better place today. A place where we are cautiously optimistic. A place where we can move from a mask requirement to a mask recommendation. Consider this. At the beginning of January, our 7-day average of daily cases was 2,700. Today, we are down to under 130. Our positivity rate is now under 10% after being 3 times higher. And our hospitals are reporting relief in their COVID admissions and in their ICUs. Based on these trends, we are confident we could end the county's mask mandate on Monday. And I'm announcing it today to give our schools and businesses time to determine how they want to move forward. Some businesses may decide they want to keep mask requirements in place based on the size and their type of business, the customers they serve, and their employees on the front line. Some schools may decide to keep mask mandates in place to protect children not yet eligible for vaccines and to protect staff who are immunocompromised. I said this before about masks, and it's appropriate to say it again. Masks have never been about restrictions. They've been a path to more freedom and to move about, stay healthy, and to allow more time for more people to get vaccinated. Masks have proven to be effective, and if you want to continue wearing one, please do. Thanks again to our residents in St. Louis County. We lead the state in vaccines, with more than 70% of residents receiving at least 1 dose and over 62% fully vaccinated. The virus remains very much among us, but it's not nearly at the dangerous levels it was just 2 months ago. We must continue to proceed with caution and continue responsible behavior to keep those numbers going in the right direction. Thank you, and I would be happy to take any questions.
Dr. Page, how should the public interpret the dropping or the ending of the mask mandate? You kind of alluded to it there, that the virus isn't done, it's not over, but it's just less. What's the proper way that you think people should read the move to end the mask mandate?
So the question is interpretation of our health department's decision beginning Monday to move from a mask mandate to a mask recommendation, depending on your individual circumstances. I think we should recognize that St. Louis County has worked together to put us in a better place with increased vaccinations and our vaccination rate getting now close to 70%, over 70% for 1 dose and over 62% for 2 doses. With masks limiting the spread of the virus in our community, we're in a much better place. I expect and hope we'll continue in that direction. We don't know what the future holds, but I'm optimistic that we've seen the worst of this. We'll continue to follow the advice from our pandemic task force, from our public health officials. We'll watch the CDC recommendations. But I think we should recognize that we're in a much better place and we're definitely headed in the right direction.
In the past, the county and the city of St. Louis have coordinated at times on these measures. What conversations have you had with the city about this decision?
Well, our question is about our coordination with the city of St. Louis. Our health department talks to their health department on a daily basis. I talk to Mayor Jones all the time, at least once a week, sometimes several times a week. It's my understanding that they'll follow us closely. They have a different process to implement their mask mandate, which requires a vote of their board of aldermen. That process changes how they remove their mask mandate a little bit differently than what we do. But I expect that we'll be very close. We've been very close from the beginning, and I expect we'll be very close on this as well.
How concerned are you, Dr. Page, that when you start removing the mask mandate, you could see an increase in cases? Are we at the point with the virus where you don't see that happening? Or do you think that's a possibility if people aren't careful still in certain settings?
So the question is about the possibility for an increase in cases with removal of the mask mandate. We don't expect that. That's not the advice we're getting from our public health department or the pandemic task force. I think we need to be thoughtful and when we do it, and we need to follow the guidelines of our public health experts. But we're optimistic that we've seen the worst of this. We're optimistic that the cases are trending in the right direction, that vaccinations have helped us a great deal. We need to press on. We need to continue our vaccinations. We need to get people boosted who are eligible for a booster. And then we need to move on and start addressing some of the other complex problems that St. Louis County has in front of them.
Can you talk about the decision of when exactly to do this? Cases were on the decline for a little bit, and they're expected to keep declining. I guess, how do you reach the point where you say, we'll lift the mandate Monday rather than just wait 2 or 3 more weeks?
Well, the question is about our decision when to end the mask mandate. We've always followed the metrics, and we've said from the beginning, our health department said from the beginning that we'd like to be down in the moderate phase of transmission and have our positivity rate below 8%. We're confident that we're on that timeline and that Monday will be very, very close to that number within a day or two either way. And we also want to give people some advice and guidance so they can plan ahead. We think that's the right combination of watching that trend go in the right direction, having our cases and positivity rate meet our metric on how we make decisions based on the data, and we also want to give people some notice so they can plan.
Is there still a case to be made that if you're in an indoor public setting or indoor setting with a lot of people, is there still a suggestion about whether or not you would advise people to wear masks?
So the question is about when we would advise people to wear masks, and I think we'll have more details of that coming forward. I'm going to wait for the public health order, which should be available for review in a few days, so folks can understand what our recommendations will be as we shift from a mask mandate to mask recommendations. It will follow very closely what you've heard in the past from the CDC, folks that are immunocompromised, folks that aren't vaccinated. But I think it would be better to look at the details from the public health department when those are available.
What would you say to people who are immunocompromised or older adults who maybe even if that after they've been vaccinated they're still at higher risk? What would you say to them about this decision if they're concerned?
So the question is about recommendations for who to wear a mask and what our mask recommendations would look like for specific populations such as older folks, high-risk folks, and folks that are immunocompromised. Our health department will have specific guidelines. I'm sure it will follow what the CDC has to say. But people that are immunocompromised, I would follow the current CDC recommendations and continue to protect themselves, especially when they're around folks that they don't know their vaccination status. But we'll have more details and more guidelines as the health department puts the mask recommendations together, and we'll be able to answer your question in more detail in the next couple of days.
On Monday, not after Monday, on Monday when Monday comes.
8 o'clock Monday morning.
Okay, 8 AM Monday morning, okay.
What would be is there any consideration that the mask mandate could have to come back if cases rise again, and what would that process look like?
So the question is about the process of bringing back the mask mandate. We would need to see an extraordinary rise in cases again. We would need to hear the pandemic task force, the CDC, and our public health department sounding the alarm. Right now, we don't see anything like that in the future, but we'll listen, we'll watch. I believe, and our health department believes, that we are past the worst of this, and Monday is the right time to move from a mask mandate to mask recommendations based on specific guidelines, and that we are coming to the end of this very difficult 2-year journey with COVID. It's almost 2 years since the first case arrived in St. Louis County, and it's time to start talking about the other challenges that face our community.
Anybody else?
Okay, thank you.